Sorkar India kalapin scam baki brio kibla lab baki don ya coronavirus sakari kidon 6,000 spa lai po hinyongut kat hadu menta. Na pedeng kini shi spa lai po lai ngut kila kwaj bat kila yo mi na kijaka sumar kibayap na kani kejingpang kat hadu menta kilong lai po prangut. Ka Indian Council of Medical Research kala ay jingmendur ya shispa an arpo santali ki laboratory jongka sorkar bat sanpawetli ki laboratory Bombay jongka sorkar ne ki private laboratory bakin le ya ki test na kabenta uknyang jingpang COVID-19. Ka sorkar pleng kala shimru ya bundat ki senjam ban pentikna ya ka jingyat bed bat ka jingpenpoi ya ki marbam syakipaj ba khnang bakipaj ba kinlaj na ki jing e. Kabor penyak distrik jong ka Dimapur Nagaland kala ay hukum ban khanglut ya baro kidukan kiyau ki jakat rekam jong ki reupat ba bat kala khangru ya ka jingya ki kali na kabenta henri phong kenta na do ko por henri baji men step menta kasni hadu ka shiteng senya jong ka lai tarik uyayong haka hukum bala penmi u commissioner katanat pulit u balongru u district magistrate u ratiha tetsyo ulaong baka jinglong jingman kalong baka dawa ya ka jingpur king shu ya ka jingami jong ki paj ba khnang bakinla banyada bat penkerpang yaladi badru banyadon cengai iwei na iwei kumbala hukum da kasorkar Nagaland. Kasorkar kala penkre ya ka Imkong Liba Memorial District Hospital kabadon ha Mukachung District kumkawei na kijaka aiding sumar ya ka jingpang COVID-19. U Menteri Rangba ke Meghalaya u Konrad ke Sangma ulah kerpat ikipaj ba nongsong snong bakin buat renti aki kendon bat kijing batha na ki bor sensyar ha ke banyele persya bat khanglat ya kijing priang jong u COVID-19. Ula angru bala pen kup bor ya baru ki deputy commissioner haka jela bakin pelaj ya kepisa ka balong arpusan lak tingka na ka MLA scheme jong usnam arhajar arpway syaki MLA kathan habakren hakinong pathai khubor hadian ka jingalang bat ki MLA ka East Khasi Hills district ringkat bat ki he sorkar ha Shillong u menteri rangba ulaong bakani ka jingja kalong ka aka ka bakhlempoi perkhat bat ki don rubun ki dieng pungkyang bat ki jing e. Menteri Rangba ulayat ru bakat kum kejing betha na katanat MHA jong ka sorkar pedeng lakhang ya ka jinglat jingwan na kawai ke district syakawai pad bat na kawai ke jela syakawai pad. Menteri Rangba ula ongru babaro kiri hakaleng ka perthai kila syemya yala ki senjam ban traikam haknega khep bat ka ri India bat ka jela Meghalaya ru kala penkriat lupa kumlu bantem ya ka jinglong jingman ka sorkar kala penkriat ru ya ka jinglong jingman ka sorkar kala penkriat ru ban bu kerpang ya ka hospital bat ai jing sumar ya kum kini gijat jingpang hadian habud. Ha asam ayok khubor baki don sangut kibriyo kiblayo ya ka jingpang COVID-19 hene kasngi. Menteri katanat ka kuat kakhya jongka Asam Himanta Biswa Sharma ulaong bayakini sangut la ai jing sumar ha Guwahati Medical College bat uwei ula syak sumar ha Silchar Medical College. Kini baru sangut kiblayo ya COVID-19 kidai kibla lej isyembenta ha ka jakale niam tabligi jamat ha New Delhi. Menteri Rangba ke Assam Sarbananda Sonowal ulakhot aware ya baro kibriyo na Assam ki balalej ya don benta ha ka jinglaniam ha tabligi jamat kabaha markas Nizamuddin New Delhi bakin wan syakmat mons ngubha daladehi syaki bor sensyar bad ulakin tu yaki bakin le ya baro kites badon kam ban baki day ban le yakites badon kam dakatanat ka kwat kakhya ka jela khnang ban khmi la kila syakta ni em ha COVID-19. Ha Tripura Menteri Rangba Biplab Kumadip ulaong balashim yaki senjam ban penpoi yaki marbam bat kiwei ki mar badon kam ki tingkong yeng jong ki briu dak bakin thop ya ka jinge tre mans ngubha jong ki khot ka National Service Scheme lambat kiwei di ki ken hun seng hakani ka por badon ka jing pakhang snong haba aji crunch ki paj ba ka jela hne ka sngi udip ulaong ka jinge ro ya karai jong ki katu ka ni ki local club hakanong ba ki belawan syakhamat ban let sa mans ngubhai ki mar syaki tingkong yeng jong ki briu. Parlok nos ngap kito kilong ki khubor kelum halor COVID-19 na ka Regional News Unit jongka All India Radio Shillong.
This is All India Radio Shillong. We will now bring to you a special roundup on COVID-19 from the Regional News Unit of All India Radio Shillong. Union Health Ministry has confirmed that 1,637 positive cases of coronavirus have been reported in the country so far. Out of these 1,637 positive cases, 133 patients have been cured and discharged. A total of 38 deaths have been confirmed by the ministry. Indian Council of Medical Research has given its approval to 125 government laboratories and 51 private laboratories chain to conduct the test of COVID-19. In the wake of COVID-19, the Union government has taken various measures to ensure uninterrupted supply of essential items so that people should not face any difficulties. The district administration of Dimapur in Nagaland has ordered the total closure of all shops, commercial, private establishments and imposed restrictions on movement of public and vehicles for 66 hours with effect from 6 a.m. today till midnight of April 3. In an order issued, Commissioner of Police and District Magistrate Rutiha Tetsio said the situation has arisen which warrants for further strict movement of public in order to ensure self-isolation and social distance in public places as ordered by Nagaland government. Nagaland government has identified Imkong Liba Memorial District Hospital IMDH under Mukuchang district as one of the COVID-19 hospital in the state. The state has now a total of 4 COVID-19 hospitals, which include Naga Hospital Authority Kohima, District Hospital Dimapur and Chedema Ayush Hospital. Meghalaya Chief Minister Conrad K. Sangma has appealed to the citizens to follow the rules and norms placed by the administration to combat the COVID-19 outbreak and said that all deputy commissioners in the state has been empowered to release the funds of 25 lakh rupees from the MLA scheme 2020-2021 to the concerned legislators. Briefing media after chairing a meeting with MLAs of East Khasi Hills district and other officials at Shillong, the Chief Minister said that the situation we are facing is unprecedented and there are many challenges. The Chief Minister said that as per MHA guidelines, the interstate and inter-district movement has been restricted. He said that all countries across the world is taking measures and India and Meghalaya as a state is also prepared to deal with the situation. The government is aware of the COVID-19 crisis globally and is prepared to designate a hospital for similar cases in the future. In Assam, 4 positive cases have been reported today. Health Minister Himanta Biswa Sharma said that all are undergoing treatment at Guwahati Medical College. The minister said that all are stable now. Another COVID-19 patient is undergoing treatment at Silchar Medical College. All had attended the Tablighi Jamaat congregation in New Delhi. Chief Minister Sarbananda Sonowal called on the people who took part in Tablighi Jamaat congregation at Markaz Nizamuddin in New Delhi from Assam to voluntarily come forward and identify themselves before the concerned authorities. He urged them to go through necessary tests and screenings by Health Department to determine COVID-19 infection. In Tripura, Chief Minister Biplab Kumar Deb said that initiative has been taken to deliver essential goods at doorsteps by involving the volunteers of National Service Scheme and other social organizations during the lockdown period. While addressing the people of the state yesterday, Mr. Deb appreciated the decision of some local clubs in the city who have already came forward to volunteer for delivering essential goods at the doorsteps of people. The Chief Minister further addressing on the government steps being taken up appealed to senior citizens and other people who are under regular medication to get the medicines home delivered. That was the special roundup on COVID-19 from the Regional News Unit of All India Radio Shillong.